Workers throughout the North Carolina mental health system have been hit hard by the accumulated effects of a failed reform plan implemented in 2001. Understaffing, forced overtime, unsafe working conditions, lack of equipment and training, and poor wages have impacted the quality of patient care. In response, members and supporters of UE150, the North Carolina Public Service Workers Union, organized a public hearing to address the crisis afflicting the state's mental health care system and to launch a campaign for a mental health workers' Bill of Rights.
On May 29, 2008, UE150, the North Carolina Public Service Workers Union, convened a public hearing in Raleigh to address the crisis plaguing the mental health system and to work toward the adoption of a mental health workers' Bill of Rights in order to establish basic standards needed for quality care. The standing room only hearing featured testimony from frontline mental health workers, including nurses, healthcare technicians, food service workers, housekeepers, and maintenance staff from throughout North Carolina's system of psychiatric hospitals and special treatment centers. A prominent workers' rights board of 8 members, 3 legislators, 2 legal experts, and 3 community leaders heard and commented on the testimony. Also in attendance were community members, patient advocates, state legislators, the media, and a representative for Department of Health and Human Services Director Dempsey Benton. Immediately before the hearing, over 100 rallied for a Bill of Rights and for a 1-year moratorium on the closing of the Dorothea Dix Hospital in Raleigh. The event took place in the context of a crisis resulting from North Carolina's 2001 mental health reform plan. The plan diverted millions of dollars from state institutions to fund privately owned community-based companies.
In many areas of North Carolina, families face long delays, confusing instructions, and all kind of bureaucratic crazy mazes trying to get their mother or daughter or son or father service. Sometimes 4 or 5 different companies, for-profit companies, treat one patient. Sometimes a person with mental illness finally builds up trust with a caregiver, and then that company goes out of business and the caregiver's gone.
When the reform plan came here in 2001, okay, they cut the beds and they sent the patients out into the community. And they also cut the staff. In the process, the community wasn't ready for that. The patients had to come back, but when they come back, you don't have the staff. And to this day, that problem has not been served. It's only gotten worse. It's time now for our voice to be heard.
Elizabeth Haddix, UE150 attorney, relayed occupational health and safety data that show alarming injury rates. For example, in 2007, there are a total of 712 injuries reported in the 4 psychiatric hospitals, resulting in 4,380 lost work days. 90% of these injuries can be traced to understaffing.
2 weeks ago, it took 10 people to put 1 patient in seclusion and restraint. 3 staff members received injuries. 1 was punched in the eye, 1 was kicked in his stomach, 1 had a hurt finger, and several staff members were spit on. This is just 1 incident of many, and when I say 1, only 1 of many.
Compounding the danger is a mandatory overtime policy under which employees routinely must work 16-hour shifts because there are not enough staff.
And our number 1 concern is for the individual. I know when I'm having a bad day. My bad day is when I can't remember whether or not I unplugged the iron before I even got started because I'm fatigued. How can I be a good staff to that individual who this is where this person lives? He's counting on me to come in and have a smile on my face to address this person and to make sure that his life is going smoothly when mine is all upside down because I have not had enough rest.
Testifying via pre-recorded video was Eric Davis, a healthcare tech at Broughton Psychiatric Hospital in Morganton. Davis was written up for being stabbed by a patient on an understaffed ward.
An incident that happened on November the 5th of 2007 is when I got stabbed by a patient I was sitting one-to-one with, and at the time we was walking down the hall, just me and him, and the ward was understaffed, and another patient come up to ask me a question, and I turned around to ask him, and once I did, I got stabbed. Had to get rushed to the hospital, lost a lot of blood, lost time, lost hours of work. Once I got back to work, I got wrote up for saying, they said that I caused the unsafe workplace because I took my eyes off the patient, and the policies are broken real bad there, and we need a voice to change these policies to make it more safe for not only patients but the staff that works there.
Davis's case is an example of how managers scapegoat workers for conditions for which the broken system is responsible. Davis, like all DHHS workers, was denied an effective grievance system to combat unfair treatment.
The forum for employees to address workplace concerns when you get a write-up, when you get suspended, when you're being investigated by a patient advocate or by the facility itself, is the grievance procedure. Now, the grievance procedure, I've met with workers for 10 years now talking about using the state's grievance procedure, is something that the workers at these facilities have no confidence in. And the numbers that I received from Secretary Benton's office actually bear out why there is no confidence in this procedure.
Workers raised the need for the human right to collectively bargain a contract in order to establish a fair and meaningful process for resolving disciplinary actions, as well as a wide range of other workplace issues. North Carolina law prohibits collective bargaining by public employees. A final issue that charged the hearing was the imminent plan to close Dorothea Dix and John Umstead hospitals and combine them into the newly built but problem-plagued Central Regional Hospital.
But we're seeing that you're asking patients, or we're asking staff traveling longer distances to go into a hospital that no one, neither Umstead or Dorothea Dix, has stepped into before, to have had a 2-hour orientation. We hardly know how to open the door and get through the hospital, to find our units, to know where we're going to be working. To be working with staff that we have never worked with before, to be working with patients that are being blended that have never been blended before, to have been given no access, to be told that we are to absorb these policies which are in the process of being written as we speak. At
the end of the hearing, each Workers' Rights Board member commented on the testimonies given. The board's conclusions were: 1. The ban on collective bargaining should be repealed. 2. Safety concerns require an end to forced overtime. 3. The closure of Dorothea Dix should be deferred at least 1 year in order to ensure a safe transition to the new hospital. 4. A mental health workers' Bill of Rights should be enacted.
The things that I heard that truly concerned me was safety, understaffing, unfair policies, poor pay, the need for a Bill of Rights, and the need for collective bargaining.
I have heard your concern, and I think one of the major things that I have heard is that you would like to collective bargain. If that is what you want, and if I can do that, anything to help get that across, I will do that.
We are looking at institutional immorality with regard to how we're treating folks, including workers and patients. I couldn't help but think of Dr. Martin Luther King and his assassination in Memphis, when he was there to help sanitation workers who were literally falling in garbage trucks and getting ground up. We are grinding up people.
Coming out of the historic mental health workers public hearing, frontline workers in UE, working in a diverse coalition that includes patient advocates, lawmakers, and community members, continue the campaign for a mental health workers' Bill of Rights.
Organize, organize, organize. Organize, organize, organize. Organize, organize, organize.
Thank you for watching Independent Voices, your source for participatory grassroots media.